to ask questions.
Ready? All right, good evening, everyone. Thank you for joining us once again for the EMA Thursday Talking Points. We felt it was time to get back in front of the camera again and address all of you, our friends and neighbors and fellow residents, on our COVID update and just share a few things about the current status of things, answer any questions. All of our media partners are in the room with us, and I know they'll have some good questions for us at the end here. I have just a few things I'll go through, and I have some questions for the mayor and for Linnell to kind of go over. I want to start by just saying there's a lot of work that goes on behind the scenes by a lot of leadership in our community, and I talk a lot about our healthcare coalition, and that is a group of every segment of our healthcare system that works very closely with our elected leaders to plan and execute our response to COVID, to make adjustments, sometimes day by day, sometimes hour by hour. There's a lot of very careful consideration and thought, and sometimes a little heartache in some of the decisions that are made in your best interest. And all those decisions are taken very seriously. And we always welcome your comments and your questions. And we want to make sure that you have the best information available to you and the resources that you need to take care of your families, take care of your businesses, and take care of our community. So with that, I will just start with some updates that I have and talk a little bit about the status of our healthcare system. There's been quite a bit of discussion on social media platforms, in the press, in just general conversation about what's going on with our ability to take care of patients. I wouldn't say we're in crisis state yet, but we're very concerned, and we're concerned about the same things that we were concerned about early on in this pandemic in that late March, early April timeframe. When this first struck, we talked about flattening the curve. We talked about the reason for flattening the curve was we wanted to make sure we had enough healthcare resources to be able to take care of sick patients. Now that the second wave is here and in full force, we're realizing exactly the impact of that. And so the same concerns exist now at this point in time, and the concerns that we have are very real. So when they talk about bed availability, whether it be locally, regionally, statewide, nationally, it isn't necessarily a physical bed problem, it's a people problem. Staffing, our talent pool, our nurses are very, very shorthanded. They were that way long before COVID, if you remember. We have been screaming as a country for quite a long time about we don't have enough qualified, skilled nursing staff and even doctors for our communities. So then when you introduce a pandemic, it makes it 10 times worse. And so we have, in some cases, staffing getting sick also, or just plain wore out because they're working double shifts and filling all the gaps. And so we have that occurring. So what's happening about that? So there's collaboration going on within our region, within our state. The hospitals talk every day. They look at where they can move patients, who can take care of what, and balance that load. And so that is the primary reason. We really need to be disciplined to do the best we can on a personal level, to do the mitigation efforts so that we don't be sick. Because besides COVID, there's all these other health conditions that still need addressed. There's still people that have strokes and heart attacks and other health issues that we need that capacity of the healthcare system to address that. PPE, that was a concern early on. It still is somewhat of a concern. We are finding gloves are a big shortage. We're doing okay in some of the other areas. So, you know, our industries have stepped up to help us with that. One of the other things we're doing about surge, you'll hear maybe news about that later, but University of Iowa has introduced a program where they, in appropriate cases, will send somebody home and do self-care, and then they get phone calls from the hospital. They get sent home with a diagnostic device that monitors their oxygen levels, and there's an interaction between the hospital and them at home. And that helps take a little pressure off that surge and the shortage of nurses. And you may see that expanded across the state and other facilities as that program proves itself out. Last thing I wanted to touch on was many of you look to us every day to provide you data on what we have locally for cases. On our waffleready.org website, We just recently this week changed to report a view that looks a lot like the state's data, because it is the state's data, off of coronavirus.iowa.gov. And what I've asked the state to do is give us the filtered down version. So what's on our page is just Walpole County data. And we did that for a couple of different reasons. One, there's been some changes in the way that works on the backhaul. You've heard the governor talk about the Iowa Department of Public Health issuing new software. It's called Domo that tracks all that. It's also the software that public health uses to track all the cases. That's where the data comes from. And so there is also a change in the way the governor wanted the data sorted by age groups. So now it's done by the decade instead of the larger age groups. So there was a bit of that. So it was just all those things necessitated us to align our reporting efforts. So on our webpage, you'll see a link to that county-specific dashboard that will link you to Walpole County's data. And then in addendum to that, we'll report to you what we have for hospitalizations and our current death toll. With that, let me move to discussing the governor's proclamations. And I wanted to ask the mayor to maybe summarize a little bit about what is in the governor's last two proclamations.
Thanks, Tim. And I think before I do that, I just want to again reiterate that this is a unusual virus. We don't know as much as we'd like to know about it, and it is serious. And so you see all of us wearing masks, and I think the question I probably get as much as anything is, why doesn't the governor just mandate a mask mandate? It really is important for you to make your own decision. I think Iowans are independent, and you know, when you're told to do something, the first reaction most people get is, the heck, I have to do that. And it's an enforcement issue, but I think it's just common sense. Wear a mask, protect yourself, and protect those around you. On Tuesday this week, the governor did enhance the previous proclamation, and she's trying to give, I think, the public a sense of how serious this is. She's given some more restrictions for gatherings of people, no more than 15 people out indoors and no more than 30 people outdoors. And those apply to some of the gatherings that people have been, quote, cheating on, like wedding receptions and bowling alleys and pool halls and so forth. So she's really given some limitations to sporting and recreational. The bars and restaurants, I think, are very similar. Closed to in-person services at 10 o'clock p.m. There's no bar seating. You have to wear a mask when you're in the facility and while playing games or eating. And I think it's important that they really want you to stay seated and be with your friends, your family. It's really important. We just don't understand the spread of this. It seems like people are still getting exposed and can have asymptomatic exposure, and so they carry it and you don't even know it. You can be tested one day, and we'll check with Linnell on that, but you may be negative today and positive tomorrow. So, you know, the addition of these restrictions are not meant to limit your freedom, but to be protective. And I think, you know, we have Thanksgiving coming up, and I personally, that's always been a fun holiday for our family, but we're not having a family get together this year. We're going to do individual family members are going to stay home and eat by themselves, so to speak, rather than have a family get together and risk exposing others to this crazy virus. We have closed City Hall. One of the things, we've had some exposure here, so we want to protect both our staff as well as people coming in and out of City Hall. So we're trying to be proactive and do what we think is best for the public. We also, as Tim mentioned, I think having staff available is really important. And when you have one or two people in a department, if somebody gets exposed, it can really shut down the city government pretty quickly. So we're trying to be proactive. You know, I think the idea that the face mask is one of the best ways. The social distancing is important. Washing your hands, covering your cough, taking good care of yourself, getting rest and sleep, and trying to at least be sensitive to those around you, because we do have a lot of people in this community that have underlying conditions and are certainly susceptible to other kinds of infection. So maybe with that, I'll stop and let Linnell make some comments, because she's on the front lines and dealing with some of our actual contact patients. So Linnell?
Well, in addition to the recommendations that you shared with them, the last one is stay home if you're sick. I mean, if you're sick, stay home. Don't go to work. This is why the virus is spreading so rapidly. And what we have found, it's not the kids as much as the adults. We have a lot of adults that have it. And so therefore, we are quarantining a lot of the kids. With that said, I'm going to tell you, we do have students that are positive and they have no symptoms. So these are what I call our super spreaders, because they're out there and they don't have one single symptom, and they're going out into the community. With students, we're also seeing where when they're asymptomatic, they're cohorting with their friends in vehicles. So therefore, there again, they're spreading it from person to person. We knew the second wave was going to occur. It came a lot quicker than I anticipated, but our health department is very small, and we are seeing anywhere from 40 cases to possibly less than 10 per day. The Test Iowa site has also increased our numbers of positives that we are receiving in this county. I have been out there helping with testing the last couple of days myself, so I've seen how the Test Iowa clinic does work. It works very, very well. We are seeing a positivity rate of about 18.9%. Yesterday, there was over 100 individuals tested. So it is serving the purpose that we had in mind when we put it in place. When I've been out there, I've seen people that have come from other states to our testing site, because what they're finding is it's hard to find a site that you can come to test. So they are coming to our site from other counties, other states. So it is serving the purpose that we set it up for. Next week, we are going to have Test Iowa open. We're looking at Monday, Tuesday, Wednesday. What we do is we make sure that State Hygienic Lab is open and that they will be processing the test, because there's no sense of testing individuals if the test cannot be processed. So we are looking at Monday, Tuesday, Wednesday. The week after Thanksgiving, what I'm looking at is having the Test Iowa site open Monday through Friday. And so therefore, there will be testing done each and every day, because I anticipate people will get together for Thanksgiving, so this virus will continue to spread. Until we buckle down and do what needs to be done, this virus is not going to slow down. I almost use an analogy of like a firefly. And this firefly is just flying, and it's flying rapidly. With our long-term cares, I saw it just in a matter of a couple weeks, from one person to over 30. So that is how quickly this virus can spread from person to person. Right now, our county is well over 2,000 positive cases. And I continue to hear where people are doing Halloween parties and weddings. And then when you ask them how many others were positive that attended these events, and they will tell you, yes, several people were positive that attended the events. You may be asymptomatic one day, the next day you have symptoms. We do look at 2 days before symptoms start, because that person is actually shedding the virus 2 days before they even become symptomatic. Because Iowa has seen such a surge, the state has recommended to us not to go after the close contacts in that 48 hours. So we have not been doing that, but I know we continue to ask to find out who those people are so we can put them in quarantine for 14 days. We look very closely at household contacts. Some people just flat out tell us they'll stay home, but I know they're not. That has been another issue in our communities. They're flat out lying to us about when they're going to stay home, when they're not going to stay home. If a child's in quarantine and they take them to a daycare when they should not be there again, it's spreading. The other thing is quarantine is very, very tricky. I know people are really confused about this. The person that is sick, they are the ones that are in isolation. So that sick person needs to stay home away from people for 10 days from the start of their symptoms. They are shedding that virus not only 2 days before they start symptoms, but for 10 days after the initiation of symptoms. Now, I mentioned the super spreaders. There are asymptomatics. We isolate them for 10 days from the day of their test because they have no symptoms. So therefore, we don't have a marker to evaluate. Then let's move to the quarantine. These are my other people that live in the household. They have no symptoms, but they're living with that person. They are in quarantine for 14 days from the last day they have contact with that person with COVID. So I've got a mom and dad with a 3-year-old. They still have to take care of that 3-year-old. So I can't start quarantine until they're done shedding the virus. So quarantine can last several weeks. So those people have to stop shedding that 10-day virus, and then I start quarantine for the 3-year-old. And it works with spouses, with married couples. If they're not able to move to a separate bedroom, then we can't start quarantine of that spouse until the other one's done shedding the virus. So this has been real confusing to people. If, for example, I have the virus, I go to the other bedroom, my husband can start quarantine from the day I move to the other bedroom. If I don't move to the other bedroom, then he can't start quarantine until I'm done shedding that virus. So I hope this does clear it up a little bit for people, because we do get some pushback about, I can't be away from work that long. I got to take my kids to daycare. The thing is, it doesn't work well. Now I'm going to muddy the waters more. My husband is in quarantine for 14 days. He goes and gets a COVID test. It's negative. That's not a free pass out of quarantine. He's still in quarantine for 14 days because that is a point in time test. That tells me that day he's negative, but the next day it could be positive. He could have COVID. That is how funny this virus is. I've never seen a virus quite like this. So he has to remain in quarantine for that full 14 days. Now on day 9, my husband starts showing symptoms. Now he goes into isolation for 10 days because he's showing symptoms. We also strongly recommend when they start having symptoms to go get tested to verify if they've had the virus. If they've had the virus and it's confirmed, they do not have to quarantine again for the 3 months. After 3 months, we don't know enough about it that you have antibodies. We have had a couple reinfections already in this county where they tested positive several months ago, started getting sick again, and they tested positive again. And in between this time, they had tested negative. So it is occurring. And we are learning more and more about this virus. My other concern that when we do the case contacts, and they do actually talk to us, because there's some people that won't return our phone calls, but when we do talk to them, we tell them, now in 6 weeks and 3 months, if you're sick again, make sure you touch base with your medical provider, because as we're learning more about this virus doesn't leave your body. You still have that COVID virus in your body, and it continues to eat away at your heart and lungs. And then vascular system is now being identified. This is a virus that mimics so many different types of diseases, and it attacks different organs in your body. Some people end up with cardiac issues. Some people end up with pulmonary issues. And then we have the vascular, where some people start having blood clots. So to me, this is a scary thing. This is not a virus you want to catch. So I strongly urge people to take the action they need so they don't catch the virus. Vaccine. Vaccine is on the horizon. They are trying to get the EULAs, the emergency use lease agreement, I believe, the EULA. I'm stumbling on this one, but they need that approval in order for us to administer the vaccine. Once the vaccine comes out, They are identifying the groups that will get the vaccine first. When it starts coming out, there isn't going to be much of it. We're not going to get very many doses for this county. They are focusing on the direct healthcare workers that are on the front lines. And let me tell you, everybody's getting tired. If you talk to any healthcare worker, we are getting very exhausted. It's been ongoing since March. And we all are saying we want this to end. But we know realistically the pandemic is not over yet. We have holidays coming up, and I know what's going to happen after the holidays, after Thanksgiving, after Christmas. People are going to get together, and we're going to continue to see surges of people getting ill from this COVID virus. So when the vaccine comes out, it'll be healthcare workers and also long-term care facilities, because I'm sure you've recognized what's going on at long-term care facilities. And those individuals need to be vaccinated. After that, they will continue to identify the high-risk groups that will receive the vaccine. We will open up our point of dispensing, and we will administer the vaccine to high-risk groups. So with that said, is there any questions from the press?
I actually, just on the subject of the reinfections. In those situations, is the second case of the disease more severe, or is it less severe? As far as symptoms go.
What we've seen with our reinfection cases, they've been less severe. And that's a positive thing.
Tim, you talked a little bit about staff shortage in a lot of these local hospitals. But I know in a lot of places across the country, it's a bed shortage. Are we seeing anything, are you hearing anything like that from our local hospitals?
Most of what I hear, it's not a physical bed necessarily. It's there's not enough nurses to run those beds. I know our local hospital did excellent job of surge planning very early on, and there's contingency plans, and there is capacity as far as physical plant. It's this nursing staffing shortage that will cause a problem, and it isn't just hospitals. It's everywhere. It's in long-term care, it's clinics, it's every facet of healthcare, and it isn't just healthcare. Our schools are facing that too. You see more and more schools going virtual because we're having teachers become ill. I'm sure the mayor can talk a lot. He meets a lot of our business owners and leaders frequently, and our businesses are feeling the impact too, aren't they?
They really are getting impacted. And I think, again, when you think of small businesses, most of those are 1 or 2 or 3 people running a small business. And if they get down with the virus, it really affects them. It also is affecting them right now because people are not coming in to their stores. We are encouraging all the stores to ask for a voluntary face mask. We have not mandated that. Again, I think it's common sense and do the right thing and just wear a mask so that you protect yourself and others. But it really is having a financial impact on our small businesses.
And I'll agree with that 100% because when we are interviewing the positive cases, they are everywhere in the community. They are in businesses, they are in schools, they are at the college. Long-term care has been in crisis staffing for the last 2 weeks. And what that consists of is that if one of their staff has COVID and doesn't have any symptoms, those people are working with the COVID patients because they have no choice. There isn't enough licensed personnel to work in the nursing homes. So we are in a crisis.
And there is, and Linnell can probably speak more to the details of this, there is an accelerated abbreviated training program for CNAs. If anybody is interested and really wants to get hands-on and help out, reach out to a long-term care facility and they know the details and can get you through that accelerated program, at least be part of a temporary solution.
I think the governor was very wise in that she did this proclamation through December 10th. She said she was going to review it on a weekly basis. That will give us some results over the Thanksgiving week and to see what happens. But again, we're anticipating that we will see an increase. And so do what you can with your own families. Again, Americans always like to celebrate Thanksgiving and family get-togethers and eat with each other. But this may be the year you just have to kind of do something different. So be really careful. And I think, medically too, she did issue a requirement that the elective surgeries do be reduced by about 50% to make sure that the hospital do have the capacity that Tim was talking about. So, people have been very critical, but the governor's done what she thought was best for our citizens. And I think she's very clear about Iowans know what's right. So let's take care of ourselves, wear your mask, stay home if you're sick, but use good judgment. That's what we're asking people to do.
And we know it's been testing on everybody's patience. We've heard of the term COVID fatigue, and trust me, we know all about it. But it's hard on everyone, not just our healthcare workers, especially them, but all of you, your families at home, as you're trying to balance work and potentially losing income. What do you do for childcare? Making all these adjustments, virtual instruction. It's all a balancing act, but it's all of us together making little adjustments, thinking outside the box, doing things a little differently, figuring out how to make it work. And to the mayor's point, we're Iowans. We're good at that. So let's continue to be good at that. We've got to go through the winter at least and see where the pandemic takes us in the spring. But we got to be patient with one another. Being impatient with each other is not helping. Any other questions?
Tim, about the Test Iowa Center, I know when we first opened, we were talking about it had that time period that would be open. Is that, do you think it's going to be extended now, more than likely now?
Yes. So originally we set a Monday, Wednesday, Friday cadence. We've had to make some adjustments around the holidays and with the lab. So what we want you to do is go to the wapleready.org website, and on there is we're going to post the schedule. So if it changes, you find that schedule there. Right below that will be the link to take you to Test Iowa to do the registration and get your QR code and your time slot to go to the clinic. And as Linnell indicated, after Thanksgiving, we intend to do a 5-day-a-week operation. So it'll be that 2 p.m. to 7:30 time slot so that it's a viable solution for our families that can't make it to a clinic during the day. And keep in mind, the clinics, your normal primary care provider is still an option. So if you have a doctor-patient relationship in any one of our many clinics in town, that's still an option as well. And the intention of Test Iowa was to help augment the services they already offer. And they're all feeling the stress again too. So I think it's going to be full capacity for all facilities, including the Test Iowa. Linnell, did you want to talk a little bit about, I know there's several conversations we have with folks about when is it proper to test? We get several people that say, well, I was around somebody that was positive. I think I need to run out and get a test. But that's really not necessarily the right thing to do.
What I usually recommend to individuals if they've been exposed to somebody that has COVID is wait until your symptoms occur. Because more than likely, if you run out immediately after you've been exposed, you're going to get a negative test. And it gives you a false sense that, yeah, I don't have it. Well, that's why we tell them to quarantine for 14 days, because we have found this virus incubates for 14 days. And some people actually don't become symptomatic towards the end of the quarantine time. So it may be day 10 to 14 before they even develop symptoms.
Another common question that I know I get a lot, and Linnell does as well, is say I'm the individual that is a friend of somebody that was exposed to somebody. So that's a couple circles out. So if I'm not the person that's directly exposed to the sick person, I don't need to worry until that person that I was exposed to becomes symptomatic.
We get that a lot with families, because they'll say the mom and dad, they're positive for COVID. So then the children need to quarantine, but the children went to school before we found out about this. So what about the other kids in the classroom? Because my kid was in second grade with all these kids. So now do they need to quarantine? No. The answer is no. Unless that child had symptoms, we don't quarantine anyone else. We look at the ones that are the direct exposures. In public health, we call them rings. And so the person that has the COVID is in the center of the ring, like a target. And then you have another circle around it. And those are the ones that are directly exposed to that COVID case. And then if you make another target, another circle around, those people we're not concerned with unless the one that was exposed gets it. Then you start going out further and further in the circle for quarantine.
we get questions about, well, why are the rules different for schools? A lot of folks think, well, we both had masks on and we were close to each other. Should we be okay? The schools are doing that. Well, no, that's two different things. You want to talk about that?
Okay, that was some guidance that we received from Iowa Department of Public Health, and there were a couple other states that evaluated this and found if the person that tested positive for COVID was wearing a mask and everyone that was a close contact was wearing a mask, they were not seeing those individuals coming down with COVID. And the other rationale behind it is we were quarantining a lot of kids in the classrooms. So therefore, we're trying to look at a way to keep these kids in school, and it's keeping them in school. And I will say, from working with our school districts, it is working. With the people wearing the masks, we are seeing a reduction that they are not catching COVID when they're wearing the mask. So it is doing what we wanted it to do.
Very good. Good comment. That's really
But,
important.
I will say, then we get the businesses that say, well, the schools can do it, so why can't we? Well, when they did the guidance, they were focusing more on the schools. They weren't focusing on businesses. So we can't apply that same rule to businesses, unfortunately.
And schools are very structured environments where we have a lot better compliance.
Well, and you
And
can
kids
do
are
more
used to,
cleaning and control of the environment, which is something we can't do when people are coming and going in businesses. It's easy.
exactly.
Yeah, the ones that are getting quarantined in the schools is the lunchtime. Because at lunch, of course, you got to take your mask off. So those are usually the kids that are getting identified that have to go quarantine.
We know that sometimes people get a little frustrated, especially as we continue to educate and answer questions about the isolation and quarantine. And sometimes the rules and guidance change a little bit, but that happens after we learn more. And it just takes time for us to learn about these things. This is a novel virus. It's been around since March. It's a relatively short period of time in the grand scheme of things, although it seems like forever. But we will continue to learn about this virus in the coming months and even years and possibly even decades. But we have to put trust and faith in the people that, like Dr. Fauci and folks like him, like Linnell, that have dedicated their lives to working in this field, studying viruses, knowing how to protect us. They're not going to issue guidance just for the sake of issuing guidance. They're doing it in the best faith and to keep us safe. It's not about taking away anybody's rights. It's not about infringing any of that. And all these recommendations are intended to be very temporary until we can get to a point in time where we can manage it, have a vaccine, understand it, and get back to some normalcy.
You got to realize we're living it day to day. 10 years from now, people are going to go back and read about this pandemic. But right now, we have to be patient. We have to do what is recommended because we are living it. We keep learning more about it each and every day.
Okay. Any other questions?
Another question on schools, as it gets colder, a lot of sports are indoors. What is the guidance as far as those go?
That was in proclamation. That was addressed, and I'll let Mayor revisit the notes here. If I recall correctly, they are not doing a lot of the youth sports. They are allowing some of the high school sports, but with visitor restrictions.
Visitor restriction are 2 tickets per student athlete, and high school and college are exempt, but youth sports are required to be prohibited at this time.
And I think you guys probably know this better than I've seen some news from some of the schools even taking it a step further and saying, well, we're just not going to have any spectators for sports. So,
And we are encouraging mask use as much as possible when they are practicing, because with this virus, you got to remember, it's aerosolized. It's in the air. And once it gets up there and you have your HVAC systems coming on, it's just like game over. The virus is just going everywhere. So there again, that's why I encourage people to wear masks as much as possible.
Now, question for you. What are you hearing from local hospitals about as far as the need for convalescent plasma goes? Would you encourage people who have recovered from COVID to go donate blood?
Absolutely. I've heard a lot of positive results from using the plasma. A lot of our people that end up in Des Moines in the hospitals, they use them, and it's just like night and day. So absolutely, if somebody's had COVID and you're able, please go and donate your plasma so it can be used, because it is unbelievable the difference it makes in those individuals that are hospitalized.
On that point, is there a time limit after you get COVID that it's better to donate like sooner, or is it, if somebody thinks they had COVID in March, for instance, but didn't have a test, is there a way for them to test and still try to help out with that?
Right now, what we know about the virus is that you have antibodies for 3 months. So if you had it back in March, no, it wouldn't do any good. It would be for individuals that recently had a positive test for COVID. If you think you have COVID, I really wouldn't recommend it, because it's more helpful if we know for sure that you tested positive and you recovered. The funny thing about this COVID, I talked about the isolation for 10 days. I want to talk about from day 10 to 16, that's when the pneumonia sets in. That's when people start becoming more ill, because what we found is when we make that phone call, usually about day 7 when we're finding out about it, is that they're not very ill at all. They may have 3 or 4 symptoms, but then by day 10 to 16, that's when they become extremely short of breath and end up with the COVID pneumonia.
Linnell, can you speak a little bit about the temporary changes the state has made to the follow-up calls and how that process works?
The protocols with the contact tracing? Yeah. I mentioned it earlier that what Iowa Department of Public Health has told us is to focus on the household contacts and not to really focus on the other contacts that they had. But we are trying to do both as much as possible, because if we don't get people in quarantine, the virus will continue to spread in the community.
So typically they get a 10-day follow-up phone call. Is that happening during this temporary order or no?
No, when they switched us to Domo, unfortunately, in our other system, when we were getting these cases, we were also following up at 10 days to release them to make sure they were feeling better and they were fever-free for 24 hours. With the system they have us on now, I call it the one and done, because we call them one time, put everything into the system, and then it's submitted to the state. So there's no other phone calls. So unfortunately, from my perspective, I'm a little disappointed, because you're not going to be able to encompass the data of who becomes hospitalized, and also the data that leads up to the death of some of the individuals, because I'm sure you've seen over the last 2 weeks, we've had a pretty significant increase in our death rate here, because we are up to 79 deaths.
And we would still encourage people that have questions or need guidance to reach out to their primary care provider. And if you don't have a primary care provider, call one of our local clinics. Somebody will help answer your questions. We don't want you to feel like you're alone out there and there's not anybody you can reach out to.
And if you don't get a follow-up phone call from us, sometimes it's because we don't have the information we need to make that contact. In this new system, they don't give us the clinics of where they were tested. In the old system, they did, so we could call the clinic and get phone numbers and get what we needed. Now with this new system, if there's no phone number in there for that case, we're dead in the water, because we don't know how to call. So we have to send it right back to the state and say we have no phone number.
Final questions, gentlemen? No?
Thank you all very
Closing
much
comments,
for your
Mayor?
interest.
Stay healthy.
Thanks, everyone. Stay healthy and please wear your mask and wash your hands.